Hi, my name is Dr. Manish Rao. I'm a consultant psychiatrist and lead clinician for the service in Croydon CAMHS. Croydon CAMHS is a child and adolescent mental health service that sees young people from 18 and under who have difficulties in relation to any emotional or mental health needs that they might have. They're referred to us from a variety of different people, so that could be someone's GP, from their school, or if there are any other professionals that might be involved in their care. And if they're concerned about what their mental health might be like, they sometimes ask us to see them to perform an assessment and determine whether they need any support in relation to a variety of mental health needs that they might have.
We're based in Christopher Wren House in Croydon, so it's conveniently located on the high street. We have lots of transport links that can drop you at the door. We support young people struggling with moderate to severe mental health difficulties, and we have many teams within the service. We have our crisis team for young people that are presenting to A&E. We have our child wellbeing practitioner team, mental health in schools team, learning disability team, and our treating teams. I'm a nurse. We have other nurses within the service. We also have an ADHD review clinic.
So we see a really wide variety of concerns relating to things like worries and anxiety that some young people might have, but also in relation to mood difficulties, so someone's feeling really low, for example, but also any more significant mental health concerns that either parents or professionals might have for a young person that's presenting early on in someone's life, like schizophrenia or bipolar affective disorder. And we would undertake assessments to see whether those difficulties are presenting early.
If we decide that your child and family would benefit from a therapeutic intervention with Croydon CAMHS, we will discuss that fully with you, particularly which of our interventions would be the most suitable for the needs of your child and family. We offer a wide range of therapeutic interventions, including psychological therapies, creative art therapies, creative psychotherapies, family therapy, as well as psychiatric assessments and reviews with our consultant psychiatrists that might include medication to help your child.
So after you've been referred to us, there would be a bit of a wait, but when you come for an assessment appointment, which would last around about an hour, and within that hour, what usually happens is that you're asked about the kind of difficulties that might be present for you and why people think it would be helpful for us to see you. At the end of that appointment, it would be made clear about what the next steps would be, and that would often involve that clinician discussing the kind of things that have come up in your appointment with other people in a team. And then after that, what happens is you would often have another appointment where some of that feedback will be given to you, including what that plan might be in terms of what would be really helpful for you to try and help you make the steps that you would want in order to make progress and feel better. So whilst you're waiting, you can access our virtual waiting room, which is an excellent place to be able to get hold of lots of resource. The first thing is that your referral actually sits within this virtual waiting room, which is a really great way of being able to see the information that was sent to us in the first place. There are also ways in which you can access resources outside of our trust. And there are brilliant services that you can find information about on there, such as Young Minds, which are really useful places for you to get extra support and information whilst you're waiting. There are regular questionnaires that are sent to you through this online platform, and what that can do is help us have the most up-to-date information about you and track your progress whilst you're waiting to see us for an assessment. There's also an opportunity for you to consent to take part in any research, and that can be really helpful for us to understand any mental health concerns that we support young people with.
You'll also find the contact details for the CAMHS duty worker and the CAMHS crisis line locally, in case your concerns about your child are increasing or there's new information that you feel we need to know about your referral. I've been a nurse at Croydon CAMHS for some years now, and I know that the team is dedicated and committed to offering the best possible service to the children and young people of Croydon.
We appreciate this is a really difficult time for some young people, and we want to reassure you that we're here to try and help support you as best as we can. I want to work with you to try and help you achieve your goals for the future.